Yeah, you know, that's how I think of myself, mother first. In fact, I spent all morning this morning insisting on writing an essay about how to make a go-kart. Turns out it's harder than you think. But I'm sure somehow that skill is going to help me to fix Medicaid. There's a lot of parts, there's a lot of moving pieces. Oh, dear, dear. Anyway, it's terrific to be here, and it's wonderful to be here with all of you who have been working so hard for so long to make progress on issues of social justice, income equality, and of course Medicaid and access to affordable health care for everybody. Where's Kate? I just lost her. To Kate, who's hardworking, who's every day, day in and day out at the State House being a forceful and effective advocate. I want to say thank you to you, and also thank you for your partnership. We're in this together. Definitely thank you to Linda. Linda rose to the challenge, and as soon as I asked her to be part of the Medicaid working group, you know, she said yes, and she's been fantastic and working hard there. Of course, thank you to Elizabeth Roberts, hardest working woman in government, no doubt about that. We're very lucky to have her and have Anya here. I noticed Representative Tansey and Handy and Senator Miller are here. It's good to be with all of you. If we all come together, I think we can make meaningful progress on what are very difficult issues facing Rhode Island. I know the main topic for today is to talk about health care and reinventing Medicaid, but before I do that, I just want to say that, you know, reinventing Medicaid is just a piece of the puzzle. As many of you know, I feel that the greatest challenge facing Rhode Island is that our economy is out of gas and we're not doing enough to create good middle-class jobs. We need to do more to make Rhode Island a place of opportunity for everybody, which means helping folks build skills, which means just creating more jobs. I mean, the fact of the matter is, our unemployment rate is down a little. In fact, just a moment of levity, maybe 6 weeks after I became governor, my staff came running in and to show me the new unemployment rate, which is, you know, substantially lower than when I took office. I'm like, you're a great governor. But anyway, the truth of the matter is, those unemployment numbers mask the real problem. Yeah, that's true. The unemployment rate is coming down, and I'm grateful for that. However, that's because a lot of people are giving up. They've stopped looking. A lot of people are employed, but they're part-time employed. And a lot of people are employed in low-paying, not family-supporting jobs. And if you actually get under the covers of the numbers and look at, are we creating good family-supporting jobs, we're not. So the majority of my agenda that I now have before the General Assembly is focused on creating good middle-class jobs and making sure people have the skills they need to get those jobs. So what are we talking about here? You know, number one, I've called on them to raise the minimum wage immediately to $10.10. We've waited long enough for that to happen. That needs to happen. Number two, I've called on them to expand the Earned Income Tax Credit Program from 10% to 15% over the next 2 years. I also would like the General Assembly, if today's the revenue estimating conference, I'm hopeful the revenue will be a bit rosier than it was in January. Well, let's do 15% right away in year one. If the money's there, let's do it. Neither one of these things, raising the minimum wage or expanding the ITC, is a silver bullet, but they'll both help a little. They'll both help a little. If you're a family living on the edge, a little bit helps. Also have a broad proposal in the budget around skills. This is a big deal. My whole life has changed because one person in my family, my father, went to college. First guy in his family to go to college. His whole family were meat cutters, and he went to college on the GI Bill, and it changed our whole lives forever. I'm proposing that we create a $10 million last dollar scholarship. We have the money. It's put forth in a balanced budget to the General Assembly. What that's going to do is provide last dollar scholarships for people who need it. You know, what do I mean by last dollar? Families can pay a certain amount, they can get a loan for a certain amount or a Pell Grant, and then there's a gap. And that gap prevents too many talented people from getting a college degree. It's time to end that. Let's get this scholarship funded. Get these kids through school so it's a ticket to a middle-class life. I also have a proposal for universal dual and concurrent enrollment. Every single high school kid should be able to take college classes easily and for free. So they can come out of high school with a year of college or more under their belt, halfway or 3/4 of the way to an associate's degree. So that when they go to the community college, they can get their degree because they don't have to be there for so many years and run the risk of not getting the actual degree. So why am I mentioning this? Because if we do, I have a comprehensive jobs plan before the General Assembly designed to hit on all of these cylinders. And if we do all of these things, we will be able to make Rhode Island a place of opportunity for everybody. At the same time, we do have to innovate in the way we provide health care to our most vulnerable. And that's why I've called together a commission to work on reinventing Medicaid. So let me tell you about that work. I say, first of all, the work of this task force really builds on much of the work that's already been done in this community. We have a SIM grant. We've been inching the system to the right place. I'm just suggesting that we move faster and a bit more boldly to build on the good work that many of you have already started. And at the core of it, it's absolutely not about changes in eligibility that, basically kick people off Medicaid. That's what it's not about. In fact, none of the proposals that we're putting forward do that. What it is about is moving the system away from fee-for-service and paying for value, not volume, and also getting people cared for in the lowest cost environment. Their home, perhaps instead of a nursing home, or in the nursing home instead of an emergency room, and on and on. And that's what this is all about. I will say I am unbelievably grateful to the Medicaid task force. When I took office, I faced a $200 million deficit. Medicaid is 1/3 of our budget. And we had a lot of work to do to move away to improve healthcare outcomes for the most vulnerable and, cut costs. But it's a challenge, it's hard to do. So I said, I don't want to do it alone. I want to call upon the stakeholders. So I said, I'm going to try something different. We're going to put all the stakeholders around the table, head of the hospital association, nursing homes, representatives from this community, who else do we have? Business community, all the experts and stakeholders that I could find, I put around the table. And I said, here's your challenge. We need a 9% cut. We need to do it without kicking people off of Medicaid. And you need to do it in a way that provides sustainable long-term changes, not just cuts. It's about moving the system. By the way, you have to do it in 2 parts. The first part, you only have 3 months, and the second part, you have another 3 months. So I'm not gonna lie, I was a little nervous. Will this work? And it did. You guys were amazing. I'm looking at you, Linda, because you played a big role in it. They did it. The ideas they came up with, I'll be the first one to admit, were better than the ideas that I put out as a straw man. Many of the first ideas that I put out were just traditional cuts. And they said, no, Governor, there's a better way to do it. And I thank you for that. So some of the things that they've come up with, instead of just a traditional cut for hospitals and nursing homes, they said we're going to move from a structure of straight cuts to an idea that we're going to incentivize better care, giving hospitals and nursing homes the ability to be rewarded and earn back some of the money for having better health care and better outcomes. That's smart. It saves us money and it delivers better care. For our behavioral health care system, we're finding an approach to lower hospital utilization. Again, we're paying for value, not just volume. Is Maria here? I don't know if Maria Montanaro is here, but she's the new director of Buddha. She's been unbelievably involved and hands-on. And behavioral health care issues have to be at the table. So in any event, we're moving, the task force has said, let's be smart about this and incentivize folks for staying out of the hospital. For providers, we're proposing moving to a model that prioritizes keeping patients healthy and promotes patient-centered care and payment models wrapped around the person, kind of a move to the medical home philosophy. And when I think I'm submitting the amendment today. Did I submit it yesterday? I submitted it yesterday. Yesterday this morning. So I submitted it yesterday. And I also put, with the amendment, proposal asking the General Assembly that if there is more revenue than we thought in January, let's make some investments in home care. Because we have to make investments in community care. Because if you're going to move folks from a nursing home or from a hospital or from an inpatient setting to a non-inpatient setting, we got to make sure there's adequate support. So I'd like to see some investments in community care and home-based care so we can take care of people properly. I'll say, so there's a lot of proposals. They've worked endlessly. I think you've done a fantastic job. All the proposals have one thing in common, which is let's seize this opportunity to lower cost and provide better health care and make people healthier. Right now our healthcare system pays to do things to patients. Instead, let's pay to make people healthy. Let's get rid of waste and inefficiency and redundancy, make people healthier, save a lot of money in the process. And by the way, when we do that, if we can get rid of our structural deficit, then not only does it make Rhode Island, a more prosperous place, but then we also have some more money to invest in schools, infrastructure, job training, and everything else that we need to make Rhode Island great and a place that we all would want to live. So at the end of the day, the Medicaid work is difficult, but I think necessary. We can't, I joke with somebody, the pace of change in healthcare is quite rapid. And we can't deny that. So if we get weak in the knees this year and do nothing, kick the can down the road, we'll be at it again next year. And the same thing for the following year. So it's a choice. Right now we have a choice. This working group has worked unbelievably hard. And the nursing homes came to the table with solutions. The hospital association came to the table with solutions. Everyone's come to the table to say this is part of the solution. So I hope we can get this done and start moving our system down a path of innovation, meeting the future, improving care and reducing cost for the people of Rhode Island. And do it in a way that's thoughtful, rational, and humane so nobody gets hurt in the process. That's the whole point of this. So I want to thank you for all of your effort. I know sometimes for those of you who work on a daily basis with the most vulnerable, it's easy to get discouraged. I often look at you and the work that you do and take, on a personal level, a great deal of inspiration, because for so long you've been advocating for the same thing, and it's like one step forward, one step back. But your stubborn idealism is a good thing for Rhode Island. So don't lose it, okay? Thank you.